Hello everyone, I'm Dennis McCarthy, the host of Inside Olean General Hospital, a news and information program for our community about the services and programs at Olean General. Today we're going to talk about a subject which has to do with wounds, wound healing, and the Wound Healing Center at Olean General Hospital. And with me today is Dr. Arthur Goldstein, who is the medical director of the hyperbaric medicine program at Olean General Hospital. Welcome, and thank you for being with us today, Doctor.
Good morning. Thank you for having me.
You know, the Wound Center is probably sometimes, what does it mean? Not misunderstood, but people don't really know what it means to have a wound center. Hyperbaric medicine, there's a lot of big words. And what we want to talk about a little bit today, I think, is just generally let the public know about the kind of work that we do at the Wound Center. Could you explain what the program does and how we go about the business of caring for patients there?
Sure. I guess one of the things that lay people may not realize is there are a number of individuals who will have an open wound or an ulcer for a considerable period of time. We define a chronic wound, which is primarily what we deal with, as a wound that's been present for more than 4 weeks and is not showing signs of healing. We do see acute wounds at the wound center as well, such as surgical wounds and other traumatic injuries, but typically those types of wounds won't develop into a chronic problem if cared for properly, and it's really only when you get past that 4-week period that defines a chronic wound, and that's predominantly what we see. What our job at the center is really to be a detective, if you will, and try and find the reason why the wound is failing to heal. And that could be a number of different reasons. Associated medical conditions, particularly diabetes, is a big factor in chronic wounds. That's not to say that diabetics will not heal wounds, but because of associated medical problems, they typically will be the type of patient that we see in terms of their non-healing ulcers.
What is it that causes a wound to be a non-healing wound, as opposed to, I mean, we're not talking about nicks and cuts that you might get at home as this kind of wound, but when you look at something, what causes that to happen, that a wound does not heal?
There could be a number of underlying reasons. As we talked a little bit, diabetics are a large part of our patient population, and uncontrolled diabetes, diabetes that's not well regulated, is a big factor in wound healing. Diabetics also have associated circulatory issues that may cause their wound not to heal. We see patients on various medications that might cause their wounds not to heal. The steroid medications or chemotherapy come to mind. We also see patients with radiation-induced injuries that will fail to heal because of the changes from the radiation. Those are just some examples of the types of chronic wounds that we'll see. So,
diabetes and care of the feet, I often hear, is that an issue that you face over there? You deal with problems with the feet or the wounds there from diabetes or neglected care for the diabetic patient?
It's not necessarily neglected care as much as perhaps education of the patients. Foot wounds in diabetics are a big problem. And the issues that we face are not only control of their diabetes, make sure their sugars are low enough so that they'll be able to heal properly, but circulatory issues arise because of arteriosclerosis or hardening of the arteries. It may mean that the arterial circulation is not sufficient to heal. Many diabetics also develop problems with what we call neuropathy, where they lose the sensation in their feet and legs. And this also poses a problem in terms of relieving pressure that may be on the wound, that a patient may not even realize there's pressure on that wound until you look at them and get them into some sort of an offloading shoe
Right.
suddenly they realize that this is the key to getting the ulcer to heal.
This is nothing to fool around with if you're out there and you have a problem. So what would you tell people to kind of be aware of if you're at all suspicious, or what do they look for, and what are the consequences of not getting treatment?
Okay. Particularly on our diabetic population, which is probably half the patients that we see, really education is the key. Most of them will talk about foot care, foot hygiene, the types of shoes they should be wearing, the types of socks they should be wearing. If we can get patients, particularly diabetics, to simply look at their feet twice a day or have someone look at their feet, oftentimes they'll find a problem long before it becomes a major issue. Once you start to get past that 4-week period and you have not healed the ulcer, healing becomes a lot more difficult. The body has changes, chronic changes that it will go through that will prevent that ulcer from healing. Some of those changes, such as forming callus around the wound, are the body's way of protecting the wound, but by the same token, it will inhibit the healing.
I see.
And that needs to be addressed, particularly in our diabetics.
So there's another aspect of the wound care. First of all, it's not just walk in and have somebody treat you once and you're all done. There's a series of treatments that our staff and the physicians go through in treating. So it's not like I'm going to be there once and I'm done. But the other aspect maybe you could address is another kind of a big word that maybe people don't know: hyperbaric medicine and hyperbaric chambers. And I wonder if you could talk a little bit about what do they do and why do they have an impact that they can help the wound to heal?
Okay. Hyperbaric treatment is basically oxygen treatment. And what our chambers are designed to do is increase the oxygen content, not only of the blood system, but of the actual tissues of the body. Patients are placed into a acrylic chamber so they could see out and we can see in. It's filled with 100% oxygen, usually under pressure, anywhere from 2 to 3 atmospheres of pressure.
What does that mean when you say atmospheres?
Sitting right here in this room, figuring we're probably a little above sea level,
right.
We're at 1 atmosphere by definition.
Okay.
And what we'll do is double or triple the pressure in the chamber depending on the condition that we're treating. We like to compare it to scuba diving, where if someone goes down to 33 feet, that's doubling the pressure that they're under. So every approximate 30 feet that you're going down, you'll be doubling the pressure again. So typically for, let's say, someone with a diabetic foot problem who's going to go into the chamber, we'll probably initiate treatment at double the atmospheres, 2 atmospheres. Another condition that we treat, carbon monoxide poisoning, they're usually going to be treated at a much higher pressure initially, and they'll be at 3 atmospheres for their first treatment.
That's basically saying that you're lower in the ocean, I guess, or further down.
Well, we're lowering the patient further down in the ocean,
Yeah,
if you will.
okay.
I like to tell patients, they'll go into the chamber. It's like scuba diving, but you're not going to get wet.
Okay.
But it does have the other consequences in terms of the pressure changes that we see.
Do most people tolerate that well in terms of that kind of therapy?
The majority of patients do. The biggest complaints that we see, and it's not common, are problems with the ears and the sinuses in terms of pressure equilibration.
Sure.
And typically, a patient who does have some difficulty, it's almost a learned response in terms of having being under pressure. Most patients will learn to clear their ears and equalize the pressure, usually after 2 or 3 treatments. If we're still seeing problems after that, we might refer the patient maybe to the local ear, nose, and throat specialist and have PD tubes put in, which generally clears the problem completely. We don't have that issue any longer.
And typically when you're in a hyperbaric chamber, how long does that treatment last? Or does it vary?
No, the treatments are pretty standard. Like for diabetic foot infection or an osteomyelitis, a bone infection, the patient will be treated basically at 2 atmospheres. And it's about a 2-hour cycle, if you will. It takes about 10 minutes to pressurize the chamber. They're then at that pressure for about an hour and a half to an hour and 40 minutes. And then it'll be 10 minutes basically to release the pressure and open the door back up.
And essentially, again, like scuba diving, you have to come up slowly.
Come up slowly. Okay. Go down slowly, come up slowly.
So then what happens inside the chamber is the oxygen acts as an agent of healing? Is that how you describe it?
Yeah, the oxygen provides changes to chronic wounds. And as I said, typically sitting here at 1 atmosphere, our oxygen level might be 80 or 90.
Right.
In the chamber, by doubling the pressure, we're able to see oxygen levels anywhere from 600 to maybe 1,000. And this is a daily treatment patients will undergo. Typically, it takes 10 to 15 treatments for the body to start to react to the oxygen treatments. The most immediate effects are on killing of bacteria, killing of infection, because bacteria don't like to see high oxygen like they're getting in the chamber. It also acts as a synergistic effect, if you will. It potentiates the antibiotics that we are going to be using on these patients. After about 10 to 15 treatments, the body will actually respond by forming new blood vessels, a process we call angiogenesis and granulation tissue formation, and that's the healing tissue. So we tell patients don't expect to see too much the first 2 weeks or 3 weeks of treatment, but then we're going to expect the body to be revved up, and if the treatments are effective, that's when we're really going to start to see some changes.
So are the treatments like once a week or twice a week?
It's daily treatments, 5 days a week.
Okay.
We don't operate normal hours during the weekends. We are there for emergencies,
right.
24 hours a day.
So it's pretty aggressive in terms of
It's aggressive, and it is a big commitment for patients. Someone who lives right in town, has a 10-minute trip into the center every day, probably are not going to be that effective. But you know, we get people coming from as far as Wellsville and some of the other towns that they've got a good trip, a half hour, 45 minutes to come in.
Well, this is the only, I believe it's the only treatment center of its kind in the area.
The closest treatment center is about an hour and a half away. Okay. That would either be Buffalo or Erie.
Okay.
One of the other things that is important about our center, we just received our national accreditation from the Undersea and Hyperbaric Medical Society.
What does that take to get that kind of accreditation?
It's an intensive review by the governing board. They were in our center for 2 full days. They want to review all your policies and procedures, almost like a JCO would when they come into the hospital. They want to look at some of your patients and see how they've done, see how you've handled various patients. There are approximately 50 centers, hyperbaric centers in New York State. I think we were, the 10th to be certified. So it's becoming more and more important, particularly some of the insurance companies now are getting to the point where they want the center that they're going to use to be certified.
Right. And that makes ultimate sense, because that kind of a program and certification or accreditation in some cases means that you've been put under the hot light and examined all your procedures and your protocols, and that you're doing it the right way, is basically what they're telling you.
I think that's really what it says for our unit being in this area, that we do a good job and treat our patients very well.
And we get an awful lot of great feedback from the patients, and I think they tell you and your staff that they're very, very pleased. But once they go through these hyperbaric treatments, you still continue to follow them. I think until at one point, do we get to the point where the wound is the wound is healing well enough, and you say, you know, off you go, or you're done, and maybe you return and they go back to their primary care physician. And how does that?
A lot of times we won't discharge someone until they're completely healed.
Okay.
And the reason for that is oftentimes a patient will heal an ulcer or a wound, but that new tissue that they formed is very fragile, and it's very prone to reopen if not cared for properly.
Right.
So typically we will at least see a patient back one more visit after they're completely healed, after we're satisfied, just to make sure there are no issues with reopening. At that point, we'll usually get them back to their primary care. We also need to work with a fair number of other physicians in other specialties in order to do what we do. Primary care and their medical physicians are important, particularly when you're looking at a complex disease like diabetes and needing to achieve better control of their diabetes in order to heal somebody. But we also have formed alliances with dermatology, podiatry, the vascular surgeons in the community to really treat everything that needs to be done for a patient. We have most of what we need here in town. Occasionally, though, we still need to refer to a tertiary facility for
Sure.
something that might be more complex.
It really sounds like a team effort. Your team working with other physicians in different places to make sure that the care comes together in the right way.
I think that is probably one of the unique things about our center is the team that we have. I'm surgically trained and have a totally different background than Dr. Dione, who
was our other physician.
was our other physician, who was a primary care physician in Olean for a long time before he started doing the wound care. Sometimes I'll see a patient and then refer him to Dr. Dione just to take a look at to see if there's something medical that I might be missing, sleep apnea perhaps, or low oximetry at night, maybe a thyroid problem that
those can have an impact on wounds?
Those can definitely have an impact on wounds.
Sleep apnea?
Sleep apnea can. Think about it. It's a 24-hour day, and we're probably awake for 12 or 14 hours. If you go to sleep and you drop your oxygen down to 60 every night, your wound is not getting proper oxygen, and it's going to be a detriment to healing.
Correct.
There are other issues with sleep apnea, but that's a primary role is just getting normal oxygen levels throughout the day.
It's all about oxygen, isn't it? A lot of it's about oxygen. I mean, would smoking be a factor that people who smoke are more prone?
They're not only prone to more disease states such as hardening of the arteries and blockages in their leg arteries, but the smoking obviously affects their lungs and their oxygen level.
Okay.
It can affect their heart as well. And we see patients who have advanced emphysema, if you will, who we know we're going to have trouble healing their wounds
Because they're not getting
enough oxygen. You can only supplement somebody so much.
Correct. Okay. Is there anything we missed? And maybe the message is, if you suspect you're having a problem with a wound, see your doctor, I guess.
I think the doctor would be the primary place to start, the internist or primary care physician. We do get a fair amount of self-referrals, patients who may have been somewhere else and for one reason or another want a second opinion or they're unhappy where they went. We will get a fair number of patients coming in unreferred. And basically, we will see anybody with an open chronic wound to decide if we are able to help them or not.
Well, that sounds like a great service, and I think the region is fortunate that this facility is in operation at Olean General. Dr. Goldstein, thank you for being with us today, and thank you for some great information for the community to know. And if you'd like more information on the Center for Wound Healing and Hyperbaric Medicine at Olean General Hospital, you can go online at www.ogh.org. Thank you for being with us today. This is Dennis McCarthy. Have a great day.